This recording is going to cover arthrology. Remember the prefixes and suffixes from the resource section. What was the prefix meaning joint? Right, arthro. The suffix ology means science of. Therefore, arthrology is the study of joints or articulation. An articulation or a joint is a point of contact between two or more bones or cartilage and a bone. We can classify articulations based upon the degree of movement permitted at these joints or the presence or absence of a space or joint cavity, the synovial cavity. Synarthrosis is also known as an immovable articulation. With this type of an articulation, the bones are held together by a fibrous connective tissue. There is no movement of a joint cavity. There is a complete fusion of bones. Examples of the cranial sutures, where the cranial bones unite together, and the sternocostal articulations, where the ribs attach to the sternum. Amphiarthrosis, or slightly movable, and with this type of an articulation, there is slight movement because the bones are separated more than in a suture, and some flexibility is permitted. There is a piece of specialized cartilage, your fibrous cartilage, separating the bones. There is no joint cavity. Examples, pubic symphysis, where the two hip bones unite anteriorly, and the sacroiliac articulations, where the sacrum unites with the two hip bones. Diarthrosis, or freely movable. With this type of articulation, there is a space between the articulating bones and is called the synovial cavity, also called the joint cavity. There is considerable amount of movement. These are the most numerous joints in the bodies. Examples are the shoulder, hip, elbow, and knee. Skeletal muscle. Myo is the prefix meaning muscle. Therefore, myology is the study of the muscular system. We learned back in the learning unit 2 that there are 3 types of muscles: cardiac, visceral, and skeletal. In this learning unit, we're only going to deal with our skeletal muscles. Attachments and gross structures of skeletal muscle. The origin of a muscle is the attachment of a muscle tendon to the stationary bone, the less movable bone. Insertion is the attachment of the other muscle tendon to the movable bone, the more movable bone. The belly of the muscle is the main fleshy portion of muscle between the tendon of origin and the tendon of insertion. The tendon is a type of fibrous or dense connective tissue that connects muscle to bone. An aponeurosis can be described as a broad, flat tendon connecting a muscle to a bone or a muscle to another muscle. It may sometimes be referred to as fascia. The basis for naming skeletal muscle. We have shape. An example of this is the trapezius. It's shaped like a trapezoid. Deltoid. The delta is the Greek word for triangular. Location. The temporalis muscle is located near the temporal bone. The tibialis anterior muscle is located near the tibia bone. The direction. The direction of muscle fibers are described in reference to the midline of the body. Therefore, rectus fibers run parallel to the midline of the body. Example would be the rectus abdominis. Transverse muscle fibers run perpendicular to the midline of the body. Example would be your transverse abdominis. Oblique fibers run diagonal to the midline of the body. An example would be the external oblique muscle. The size. The terms magnus, minimus, and major refer to large muscles. Minimus or minor refer to small muscles, and the term longus and brevis refer to long and short, respectively. Examples would be the gluteus maximus muscle, the large muscle of the gluteal or buttocks region. The gluteus minimus muscle is the small muscle of the gluteal or buttocks region. Adductor longus muscle is a long muscle of the thigh. Adductor brevis muscle is the short muscle of the thigh. Muscles can be named for their number of divisions. This usually refers to the number of heads. Take the word bicep. This word literally means 2 heads. Bi means 2 and seps means head. Example would be your biceps brachii muscle, which is the large 2-headed muscle of the arm. The triceps brachii muscle is the large 3-headed muscle of the arm. The quadriceps femoris is the large 4-headed muscle of the thigh. They can be named after their attachments, the origin and insertion. For example, the sternocleidomastoid muscle originates on the sternum and the clavicle and inserts in the mastoid process of the temporal bone. Another example would be the stylohyoid muscle. This originates at the styloid process of the temporal bone and inserts at the hyoid bone. They are named as to whether they are superficial or deep muscles. Examples: your internal oblique muscles are, by definition, would be deep because they are more internal. And external oblique muscles, they are more superficial muscles. They are named according to their action or movement. One of the main functions of muscle is movement. Therefore, naming muscles according to their action is important. So let's define the type of movements that muscle performs. Flexion is a muscle movement that decreases an angle at an articulation or joint. Think of this as bending your arm or legs. Muscles that do this are called flexors. Extension. This is a muscle movement that increases the angle at an articulation or joint. Think of this as straightening out what you just bent. Muscles that do this are called extensors. Abduction. Abduction is the movement of an extremity away from the midline of the body. Muscles that do this are called abductors. Adduction is the act of moving an extremity towards the midline of the body. Muscles that do this are called adductors. Supination is the act of rotating the forearm so that the palms of the hands are facing superiorly or anteriorly. Muscles that do this are called supinators. Pronation is the act of rotating the forearm so the palms of the hands are facing inferiorly or posteriorly. Muscles that do this are called pronators. Elevation is a movement in which the part of the body moves superiorly, lifting of a body part. Muscles that do this are called levators. Eversion is the movement that turns the foot outward at the ankle. Movement of the soles laterally, so the soles of the feet face away from each other. Inversion is a movement that turns the foot inward at the ankle. Movement of the soles medially. Protraction is the forward movement of a part. For example, the movement of the mandible, which is your lower jaw, or the shoulder girdle forward on a parallel plane to the ground. Retraction is the reverse of protraction. It is the backward movement of the part of pulling the lower jaw back in line with the upper jaw. Rotation is the movement of a bone around its own axis with no other movement. For example, turning your head from side to side. Circumduction is the action or swinging of a limb in a circular movement. This movement is actually a combination of flexion, extension, and adduction. For example, the moving of the humerus is in a circle at the shoulder joint. Constriction refers to the reduction in the size of an opening, passage of the body, or a blood vessel. Dilation refers to an increase in the diameter of a body opening or passage of a body or a blood vessel. The terms constriction and dilation refer to the actions of the circular muscle tissues called sphincters, which can act as valves to guard body openings. Sphincter muscles are circular muscles that constrict an orifice. For example, the orbicularis oris muscle closes the lips. Orbicularis oculi muscle closes the eye. The external anal sphincter will keep the anal canal and orifice closed. Names and general locations of skeletal muscles. Don't get nervous now. We're not responsible for anything other than just knowing the location. So the muscles of the head, you have the occipitofrontalis muscle, which is also known as the epicranius muscle. This muscle is divisible into two muscles, the frontalis muscle, which is situated over the frontal bone, the forehead area, and the occipitalis muscle, which is situated over the occipital bone in the back of the head. You can associate this with the occipital artery if it helps. These two muscles are united to each other by a strong aponeurosis called the gallia aponeurotica, and your textbook refers to this as the epicranial aponeurosis. Muscles of the neck. We have the platysma, omohyoid, and sternocleidomastoid muscle. Muscles of the trunk. So we're talking about the back muscles of the trunk. You have your trapezius muscle and the latissimus dorsi muscle. Major muscles of the chest. You have the pectoralis major, pectoralis minor, external intercostals, and internal intercostals. Muscles of the abdomen. External oblique, internal oblique, transverse abdominis, rectus abdominis, and the psoas major. The diaphragm. This is the principal muscle of respiration. So that takes care of the trunk. Muscles of the upper extremities. The muscle of the shoulder. We have the deltoid and the teres major. Muscles of the arm. Biceps brachii, triceps brachii, coracobrachialis, and the brachialis. Muscles of the forearm. Flexor carpi radialis, flexor carpi ulnaris, flexor digitorum superficialis, the brachioradialis, this is a superficial muscle, the supinator, which is a deep muscle, and then you have your pronator teres muscle. Muscles of the lower extremities. Muscles of the gluteal region, your buttocks, is your gluteus maximus. Muscles of the thigh, sartorius, quadriceps femoris, adductor longus, adductor magnus, biceps femoris, semitendinosus, and semimembranosus. Muscles of the leg, the tibialis anterior, gastrocnemius, this forms the bulk of the calf, and that helps in our walking, and the soleus muscle. The calcaneal tendon, or the Achilles tendon, is the strongest tendon of the body, and is also the common tendon between the gastrocnemius muscle and the soleus muscle. Muscles of the quadriceps group, these are located in the anterior or front aspect of the thigh. The rectus femoris, vastus lateralis, vastus medialis, and the vastus intermedius. Muscles of the hamstring group, these are located on the posterior or back aspect of the thigh. Biceps femoris, semitendinosus, and the semimembranosus. We need to know which muscles belong to the quadriceps group and the hamstrings. The diaphragm or phrenic. This is the principal muscle of respiration. Remember, it is a dome-shaped muscle that separates the ventral cavity into an upper thoracic and lower abdominal and pelvic cavities. It has 3 openings. Another word for openings, foramen, aperture, or hiatus. So the 3 openings are the aortic orifice. This is going to allow for the passage of the aorta, the azygos and hemiazygos vein to pass. The esophageal orifice allows for the passage of the esophagus and vagus nerve. The inferior vena cava orifice allows for the IVC to pass.